Welcome, folks. Give us just a moment to get everyone situated in this Zoom room, and we will get started. Thanks for being with us.
Okay, I am ready whenever you are.
Great. Thanks so much, Isabel. Good morning, everyone. Welcome to this special meeting of the Universal Health Plan Governance Board. I'm Michelle Glass, the co-chair of the Communications and Community Engagement Work Group, along with Amy Fellows. We will be sharing with you all a kind of general arc, walking you through the outline of the report on focus group engagement today that you all received via email, and it is posted publicly on our website. So if we can start with a roll call, I'll pass it to you, Isabel.
Thank you. Good morning, everyone. Helen Balonka.
Here, good morning.
Judy Richardson.
Here.
Chenwei Chi is unavailable today. Amy Fellows.
Here.
Michelle Glass.
Here.
Mary Lou Henrich. I see you if you're able to unmute.
Aloha, I'm here.
Thank you. Cheryl Ramirez. Don't see Cheryl yet. Mike Leahy.
Present.
Thank you. And Bruce Goldberg is on leave. So thank you, everyone.
Perfect. Thank you, Isabel. So we have a pretty brief agenda today, very focused, but we are going to talk through the report. We have 3 people signed up for public comment, which we are very grateful for. So thanks for joining us early and sharing your thoughts with us. And then we will adjourn the meeting. Just a quick note about Zoom logistics for today. There is translation. And so on the bottom of your screen, you should be able to click on, it looks like a globe. It's, sorry, we have interpretation. You can click your language preference there if you would like to listen in Spanish today. And then board members will be able to ask questions, but members of the public who did not sign up for public comment will only be able to listen in today's meeting. So just so you know ahead of time. And we also received some written public comment for this meeting. So thanks to folks who took the time to read the report and write into us. The public comments are posted on the website and part of the public record. And I just want to say, for any questions about the focus group process and methodology, I would direct people to the publicly available report. And it lays out kind of the process and should answer any questions. And so that is, again, on our Universal Health Plan Governance Board website. So we're going to spend the next maybe 20 minutes walking you through what we heard in the March focus groups, because we want to leave plenty of time for board member questions. Before we start into that, I just want to acknowledge the report itself. Board members, you received it last week, and I hope you've had a chance to dig in. So this presentation won't get into all of the details, so please bring your questions. And I also want to just make a note about Amy and my roles. We were deeply involved in the planning, the materials development, the outreach, the recruitment, and the debrief process. But like all other board members, we did not participate directly in the focus groups themselves. And that was, of course, intentional to protect the commitment that we made to participants about anonymity and to create a space for candid conversation without board members present. The sessions were facilitated by our fabulous consultant at Artemis Consulting, who is here with us today. Thank you, Diana. And Executive Director Mimi McDonald was also present. So if there are questions about specific feedback with a specific group, they are on deck to answer any questions that Amy and I can't answer since we weren't in the room. Before I hand it to Amy to set the stage, I also just want to acknowledge what it took to make these focus groups happen. So we had 11 different groups. They were 90-minute sessions. And I know that people are busy running clinics and leading organizations and navigating the health system themselves. And I'm just so grateful for the folks who showed up and gave us their honest and sometimes really blunt feedback. And that's great. That's exactly what we need. So thank you. And then I think we're ready to get into the actual focus group feedback itself. So I will hand it over to Amy.
Okay, next slide, please. Great. So the process, so this is just a quick overview of how we designed and ran the process. The Community Engagement and Communications Committee led this work. We drafted invitation lists by drawing on recommendations from committee members, board members, and community contacts. We wanted a genuinely broad cross-section, and I think that we got there. So you can see in the box the groups that included. There were 12 groups in total, from community members and culturally specific providers to health insurers, hospitals, labor unions, large and small businesses, and organizations led by people with disabilities and deaf and hard of hearing communities. Each session was 90 minutes. Before attending, participants received a summary of the board's decisions as of February, and the same packet it's the same packet that's been publicly available, so people came in with at least a baseline understanding of where the board is. Questions were developed based on interviews with committee chairs, recommendations from the KEC, and then reviewed and honed by Michelle and I. So we were asking about the things the board actually needs input on and not just general impressions. Next slide. The first set of themes we want to walk you through is around benefits, what should be covered, and how people should be able to access care. Across nearly every group, people affirm the core vision of the plan, the idea that everyone deserves care regardless of their employment status or income. That resonated. But people quickly moved from the vision to the details, and the details got complicated fast. On benefits, participants focused a lot on the scope of coverage, what's in, what's out. Non-medical services came up, things like transportation, housing supports, services that affect health but aren't clinical care. Dental came up in group after group as something people felt should be a core part of the plan, not an optional add-on. Vision was raised too, though that somewhat less intensely. And you can see here the quote about dental, that dental in particular is critical. There are so many cascading health consequences that can happen for folks if they are not maintaining dental care alongside primary care, was one of the quotes from the groups. On access, participants were paying close attention to provider access under the Universal Health Plan. Who counts as an authorized provider, how referrals would work, and whether people in rural areas or with specialized needs would actually be able to get care. There was also real concern about coverage for expensive or experimental treatments, how those decisions get made, who makes them, and whether there would be transparent processes people could trust. The through line in this section was people want the promise of the plan to match the reality of care. Coverage on paper doesn't mean access in practice. And Michelle, next slide.
Next slide, please. So next, we're going to look at two groups who had a lot to say, and also, groups that the board I know was really interested in hearing from. I'm still seeing, oh, there it is. Okay, sorry. There was a delay on my end. So this was providers and employers. So on the provider side, there was some excitement about administrative simplification. The current system, as we all know, burns providers out. We heard about billing and navigating how much capacity it takes to navigate insurance prior authorizations and multi-payer contracts with different rules, and just the burden that all of that puts on providers. So we do have a quote here that illustrates kind of that promise of administrative burden having a real downstream impact on the provider shortage by attracting additional clinicians to the state. So that was great. And then there was also a lot of concern about what the plan does for patients and for the ability of providers to do their jobs and really focus on patient care without drowning in paperwork. So that was something that we heard. From providers on the rates and payment models, we did hear some good questions. Global budgets, for example, got mixed reviews. So some providers saw the value in predictability that global budgets might offer. But we did hear some worries about unintended consequences, like a concern that a global budget for a hospital could force something like care rationing. Fee schedules also raised questions in the group about whether those payments would be adequate, and really wanting to know what the process for setting that fee schedule would be, and how transparent it would be, and how people could participate directly. On the employer side, we heard that decoupling health coverage from employment was actually something that landed well with a lot of employers, especially smaller employers. That provides real administrative relief and a competitive advantage for attracting talent, especially if you're a small employer and you don't have the funding to offer a large, expensive health plan. There's also the tax piece, which we heard from, and that's where things get a little more complicated. So we did hear some participants generally liked the idea of a graduated tax that protected people under 200% of the poverty line. But there was also a real concern about how the state will attract and retain skilled workers, and whether the universal plan would be enough to balance a higher tax burden for those high earners. Employers also flagged that the cost analysis for employers doesn't currently include our friend ERISA and the cost of ERISA plans. And so they felt that that made our current plan incomplete. And we know that there's more work to do. So that's a specific piece that employers would like to see some more work on. We also heard from labor groups questions about collectively bargained benefits and what happens to those, and how transitions get negotiated. So some great questions from labor. There was, some general interest, excitement about the concept, but there was a real hunger for more specifics that the board doesn't have yet from employers, which makes sense. So we have been, of course, tasked by the legislature to develop a finance plan first and foremost. And it is clear that focus group participants have a lot of questions that I think can help direct us as we continue that work. Next slide, please. So when we look at costs and the structure of the plan and governance, this is where we got a lot of good feedback as well. So on cost, people understood what the board is proposing as a fundamental restructuring of how healthcare gets paid for. And they wanted to know what the real mechanisms to control cost over time might look like in this plan, which is a great question. So, they said, we understand these projections, but what would keep this system from growing faster than, the revenue could keep up with? I know that's a question the board has wrestled with as well. We also had a question on revenue and political feasibility. So we did have a focus group participant, for example, ask, if Oregon is struggling to pass a gas tax to fund our transportation system, how would these new taxes to fund healthcare, be able to be passed? So that's an interesting question. And the board, I think, in this phase of the work might not have a complete answer, but it's a great thing to keep in mind as we continue our work. On governance and structure, there was a real consistent theme around the real needs that local communities have, and that might be different from each other or from what it looks like it's in the centralized power centers of the state, like Salem and Portland. And so there was some worry about a centralized system that could lose sight of community variation. Rural communities have different realities than urban ones. That's a theme that came through in these focus groups. And culturally specific providers have different communities, unique relationships with communities than large healthcare systems. So also a question around how we listen to those voices in governance and not lose sight of them. So we do have a participant shared that, the only thing more local than politics is healthcare, which is not a new concept here, of course, in Oregon. The Regional Advisory Council structure did get some attention because of how it relates to this theme. And so people had a lot of questions around how that would actually function, how it would relate to that centralized portion of the system, and whether they would have real influence or just have advisory roles with no teeth. So I will pass it back to Amy.
All right, so this slide is about transition. If there's a single area where we heard the most uncertainty and the most urgency at the same time, it was around transition. People understand this plan doesn't flip on overnight, but many of them wanted much more clarity about what the path actually looks like. One participant called it the big thorny question. They said, you'll see the quote here, "My big thorny question is, how does the transition work? Because that seems fraught with peril." There was also a real tension that kept surfacing between the urgency of the problem and the difficulty of the moment. Medicaid cuts, federal uncertainty, strained providers, people are feeling all of that. And yet moving fast on something this complex carries its own risks. As one participant captured it, there's the tension of, we desperately need this, and this is a terrible time. What was encouraging is that people weren't saying, don't do this. They were saying, show us how. There was openness to incremental approaches, moving in stages, taking pieces of the system and transitioning them over time rather than all at once. One participant offered, I do think that there is a way to transition this where you take chunks over time and move closer to alignment. That's an invitation. It's the community telling the board, you can build more support if you tell a clear story about the path. And Michelle, next slide.
So we're almost to your questions. Want to quickly touch on some of the recommendations that came out of these focus groups. So based on everything that we heard across all of these meetings, there are kind of 6 recommendations that emerged for the board's consideration. One is to define and communicate the pathway to universal health plan. So not just what the plan would look like, but really how we get there. And I know that that's the work that the transition committee is working hard on right now. But I think that that is something that people really were excited to hear more about. The next one is a directing targeted analytical work to address key questions. And I think that we really discussed this as a board at our last board meeting. So cost containment mechanisms, payment rate adequacy, impacts on wages. There's just more analysis that's needed. And this is likely a future phase of the board's work that we should really look at this feedback as we frame the funding requests and recommendations to the legislature in our report that's due in September. The third recommendation is to continue to elevate that transition planning and risk mitigation. So transition planning was an area of concern across nearly every group, and it really deserves dedicated attention, not just as a stage in our timeline, but as a substantive and ongoing policy challenge with focused capacity. The fourth recommendation is exploring the use of transparent evidence-based processes for difficult trade-offs. So as you heard kind of in this summary and as you read in the report itself, some of the decisions around what's covered, how rates are set, are really just genuinely hard trade-off decisions. And so people really want to trust that those decisions are made fairly. And for that, we're going to need clear, open processes that build that trust. So I do just want to elevate that Mickey Durding from the Community Engagement and Communications Committee has recommended a great civic assembly model as a potential way to handle this in future phases of the work. And we're happy to share more about that. The fifth recommendation is committing to continued community and public engagement during transition planning and beyond. So of course, this focus group process was a good start. It was great to have a draft plan to present to the public for the first time. But people really want ongoing opportunities to weigh in as the plan develops, and not just at the beginning and not just through formal comment periods. So I know that that's something Amy and I in the CECC are working on recommendations for the September report on, but would really welcome board members' ideas as well. And then finally, reviewing questions for future consideration. So the written report includes a set of questions that surfaced in the focus groups and that the board has not fully addressed yet. So those were flagged explicitly so that they stay visible, especially for the transition committee and as the work continues. So really encourage board members to pay special attention to those questions. And I will pass it back to Amy.
And next slide, please. So that's the overview. We want to thank everyone who participated in the focus groups. There were 12 groups, many voices and perspectives. People gave us their time and their honesty, and that will strengthen and focus the work of this board. We also want to express our deep gratitude to Artemis Consulting and to Wentz Jackson Consulting and to our amazing staff team, Mimi, Isabel, and Lee, for all of the work and thought that made these focus groups and this report so impactful. Really, thank you for your expertise and heart that you brought to this engagement. And all of March that you gave. We have plenty of time for questions and conversation. We'd love to hear what's landing for you, what you want to push on, and what you think the board should do with what we heard. So now is time for questions, and we will be fielding some if they're specific to the actual focus group to Mimi and Diana.
Yeah, and feel free to ask about anything we presented, but also, of course, anything that you highlighted or circled or wrote in the margins of the report as you were reviewing it. So it doesn't need to be limited to what we just presented. So again, questions and answers for board members, and then there will be public comment at the end of the meeting. Helen, please.
Thank you so much, Michelle and Amy, and of course, Diana and Mimi and Isabel and Lee. This is fantastic work and really appreciate all the insights of this report. Every time I read it, I feel like I was like, was that there before? Because like there's so much there that every time you read it, you get more sort of something else sticks out or provides an insight. So really an amazing amount of information. You alluded to it a little bit through going through this, and I appreciate that, Michelle and Amy, but I'm so curious about like the energy of these meetings or like the general feel of it. What was it like? Mostly people were excited about this possibility. Were most people sort of daunted or worried, or did groups differ in that? Did you get a sense of that this is something people really want, then they have these concerns, and only if we could address this? Or is this like, wow, this is overwhelming, too much? You know what I mean? Like, what was the general feel of it? Can you comment on that?
I would defer to Mimi and or Diana for this question.
I'll let Diana go first.
Thanks. Thanks so much, Helen. Diana Bianco with Artemis Consulting. I would say that it differed across groups. One of the things that is mentioned in the report that I really appreciated is that everybody came without exception to these groups, like willing to talk and share and speak transparently. And so that was that was my overwhelming, like nobody was there to either say, you have to do this or don't ever do this. Folks sort of brought this, I think, interest, curiosity, and willing to share their input. And I think I think people who showed up were engaged. So the energy in all of the focus groups, I would say, was one of people being present and participating. And so, but it was a range. I mean, nobody, as I say, there wasn't an extreme, don't you ever do this, or you have to do this. It was both. Mimi, I wonder what you'd add to that.
Yeah, I definitely agree. There was a range. I will say, and of course, because of my background in being a provider, the people who were most excited about it were people who were practitioners. So they're like, oh, please, like anyone who worked directly in healthcare was just saw the need and was very excited. I would say that group, and then the group who people who sort of, I don't want to say specifically which group, but like who dealt directly with people who needed services. I would say those the people on the front lines were the most enthusiastic, in my estimation, the most enthusiastic and the most excited about it. So there were others less excited for sure, but that was my take on it.
Yeah, and I would just say this was really intentional in the outreach and the recruitment. Like we really leaned into saying, we are not here to sell you a plan. We are not here to ask you to, come if you think it's great and stay away if you don't like it. Like we made some phone calls to some groups who were more skeptical about engaging, and some groups who did not choose to engage in the last phase of community engagement for the task force. And the conversation was really, what it looks like on the ground. What unintended consequences there might be for legislation that sounds good, kind of at the high level of the board or the legislature. And we really need that perspective. We really need you to ground truth, what you're seeing. And and people, I think, responded to that, and brought those perspectives. Mary Lou, I see your hand.
I guess I need to apologize a bit that I think some of you know that I am on vacation and I have read the report quickly, but I haven't been able to print it out and write in the margins and do those kinds of things yet. So help me if I'm sorry if I'm bringing up things that were really already in there, but how many people did we end up having? And were they, did we have enough of of all the different various types that I know that last time we were told that like insurers didn't come to the table. Wonder if any did this time, and also any of the larger health systems.
So great question, Mary Lou. There is a section at the end of the report that describes kind of the process and answers some of those questions really
Okay.
directly. But yes, when we looked across the groups that we had set out to engage, we were really happy with the response that we got across each and every of those perspectives. And yes, we were very thrilled. I personally took it as like a personal challenge to make sure that we did have engagement from some of the groups that didn't choose to engage the last time, like commercial payers, and coordinated care organizations. And we did have great feedback from both of those groups. And we also did have some large systems engage with us, including hospitals and others. So great
Thank you.
question.
Great, thanks.
Helen.
Just to follow up on that question specifically, Diana, you explained this to us, to the board and to the staff, but I wonder if, just for the sake of the public, you can explain why the responses were not segregated out by groups. Like you don't have a section of here's what insurers said, here's what providers said. If you could explain a little bit about how you oriented the responses that way and why.
Yeah, absolutely. So one of the things one of the things we did promise to all participants was that there wouldn't be individual attribution to individuals or organizations. So that's just a sort of basic thing. So we wanted to make sure. But the reason I organized it this way was because even though we had different questions for different groups, there were themes that spanned across all of the groups. So it didn't, I looked at organizing it both ways, but when I organized it by group, it felt like there was repetition. So some things that perhaps you might not have expected to come from Group A did come from Group A and were similar to what Group E said, even though they are really different groups. And so I was maybe a little surprised by how many themes there were across the groups. And so that's why I ended up organizing it that way. I hope that's helpful.
And things like, insurers have a perspective as insurers, but they also have a perspective as employers.
Exactly.
And as personal consumers of healthcare, that kind of thing, right?
And folks that I wouldn't have expected, or not even wouldn't have expected. I didn't ask, so of some groups, I didn't ask a question about, we didn't ask a question about the economic impacts of this, but those groups raised that independently. Or some groups, who I raised the impact of taxes, but other groups who we didn't necessarily ask about administrative simplification talked about administrative simplification. So that was what was one of the things that we're interested, because we did have at the beginning and the end of each focus group the same questions. And so in those two questions, the first one was, what are some of the problems in the current system that the universal health plan could address? And at the end was, is there anything else you'd like to tell us?
Mhm.
So that there were themes across all. And so that's why it ended up being organized that way.
Great.
Thanks, Diana. Mike, I see your hand.
Thanks. Well, first of all, I definitely want to thank all of you that have done this incredible work. I have kind of a comment and a question. My comment is I participated in 4 of, I guess, the 8 or 9 community sessions that Healthcare for All did, and I was struck by a couple of things that don't seem as explicit in your report. So I wanted to get a sense of this and maybe get Mary Lou to comment, since she was in probably more sessions than anybody else. And that's affordability. It's the financial plan. It's the elephant in the room for the governing board. So my question is, how do we integrate some of the dialogue that we're getting from people that are making comments to our board from these HCO sessions and from your work? Because I see some overlap, but on the other hand, I see such a diversity of opinions that I'm not quite sure how that's going to help us move toward a consensus and then a final plan.
Yeah, that's oh yeah, that is an interesting thing to think of. I mean, I didn't go to nearly as many of the town halls, but yeah, I'm guessing part of, at the town halls, I think there was a little bit more, the folks that come to those are already people who are engaged and interested in this, probably more so than in the focus groups necessarily, where, we were talking to people that have not necessarily been following our work
Mhm.
as closely.
Yeah.
That'd be one guess.
Go ahead, Michelle, and then I can address the HCAO question.
Oh, sure. I think that one of the things, Mike, I really appreciate you raising that, because it is something that Amy and I and the CECC are talking about, is how do we, as the CECC and as the co-chairs, Amy and I take all of the different inputs the board is getting and package them and present them back to the board in a way that is more actionable, rather than like a 60-page PDF of public comment. So that is something that we are working on, and have a process that we will be starting to present, I think next month at the board meeting. And we've been having some conversations with Helen about that. So it's a great question. I also know that HCAO conducted a survey and will be sharing that with us. So that is a great way that we can incorporate some of that input. And then to Amy's point, part of the goal of the focus groups was to widen the circle, right? To expand the types of people we're hearing from, because we know that Healthcare for All Oregon organizes a specific base, and brings those folks to our meetings and hosts town halls, and we're really grateful for that. And we also know there are a lot of people outside of that circle with perspectives that we aren't hearing yet. And I think we really met that goal of hearing from folks we haven't been hearing from so far as a board. Go ahead, Helen.
Yeah, exactly right. And when HCAO reached out to the board with the idea of hosting these town halls, it was clear that we wouldn't be able to engage with them as much as they wanted, but I made clear to the organizers that it's really important, that we're really interested in the feedback, and any feedback that they get, the board would be more than interested in hearing about it. So we're hoping that any messages or any sort of comments, feedback, questions from all of those town halls will find its way back to the board. And then, as Michelle said, we're working on a strategy to think about how to frame all of the public comment we've gotten, whether from the town halls or the written and oral public comment at our meetings and the CECC meetings, just to put it all in a way in the report to reflect the fact that that many people have given us feedback and input And there are lots of ideas and recommendations from Oregonians who really care about this. So we are working on, coming up with some sort of structure for it. It will be included. This report that we're talking about today really was a chance for Artemis Consulting to give us their findings from these specific focus groups. So yes, that feedback is not in this report because it's just intended to present the work of these focus groups with the identified communities.
Yeah, and the groups that we legislatively were mandated to do this work with for the focus group piece.
Mhm.
Mary Lou?
Excuse me, I think that's true that one of the things that has been, I think, a bit of a frustration to me as a board member is trying to kind of assimilate the various inputs that we get at every board meeting from the public, either written and or the oral ones that then you have to kind of go listen to the whole or to the end of the meeting kind of thing. And especially the ones that have come in there, they're listed at the meeting, that these people gave input. Okay, but I like the idea that you're trying to kind of pull that together, and whether having it in another space on the website or something so that we could see all, so I could quickly find rather than having to go back to each meeting and look for the public input, whatever that. I'm glad you're trying to do that. It's complicated, I know,
Mhm.
and not easy. And anyway, but I'm glad. And then I also do think uh, that it will be good also to see what comes out of the surveys that they did. And having been in a lot of the town halls, they did specifically stop the meeting and say, okay, time now to either use your phone or here's a paper copy and to complete that survey. And I do know that Rebecca Schoon, who has experience in this kind of stuff, was helpful in, I think, putting that survey together. So although I didn't look at it real closely, it will be interesting to see what the comments and how that came back.
Helen?
So one piece that's really interesting about this is we do get a lot of public comment and feedback from various groups. And getting back to this report, it also showed up in this report. And I think this is something that we as a board need to really wrestle with. We have been wrestling with some of it, but really think about that we get really strong feedback that is mutually exclusive. So one thing that showed up in this report that I find like a super fascinating issue are the competing priorities of administrative simplification and more involvement and engagement by local communities. We talked about this a bit at the board about the role of these sort of regional entities and how much local control there would be. And, if you build a structure where each community, it has a lot more control and even sort of controlled part of the budget and could spend it the way that they wanted, or had a role in designing a system that worked better for that region. There are so many advantages to that, right? And we've seen a lot of that work happen at CCOs about you can be way more responsive to the community, you can spend money the way that you want, you can organize things the way that you want, you can do metrics that are more meaningful in your area. Right, but it adds a layer of administrative complexity, right? And so we get a lot of pressure about this has to be as simple as possible and minimize administrative costs and make it like as streamlined and efficient as we can. And that is also an extremely worthy goal, but those two are at odds with each other, right? Like if we make it administratively simple, it means less sort of a local administrative structure, less ability for local communities to be involved. And I don't know, there are really good reasons to do both, to build up more administrative structure and to have that, and then to minimize it and keep it as simple and low cost as possible. And it's one of those things that we hear all of that feedback, we really do. And it sometimes is mutually exclusive, and the board needs to sort of wrestle with which one they're going to land with, which it doesn't mean that we're not hearing it or not incorporating it. It just means that sometimes we can't do both.
Yeah, I had a different comment, so I didn't know if anyone wanted to respond to Helen
Yeah,
before I.
thanks, Helen. I think that is one of the things that is actually really promising is that these tensions are being surfaced. I mean, we've been wrestling with them as a board since we've formed, but they're really visible to focus group participants too. They're naming them, they're pointing them out, they're elevating them. And I think it really, one of the things we talked about in the first months of our board work when we had our subcommittee on values and principles was, how do we make this community ownership piece real? And I think that there is a really big opportunity that I see with something like the civic assembly model, which for folks who aren't familiar with it, it's a way to say, here are the tension points. Here are the things that are mutually exclusive, that are choices. We can't do both. We have to do one and we have to do the other. And there's benefits and drawbacks to both approaches. And so what a civic assembly model does is it brings in members of the public who are randomly selected, and they're representative of the population of a state or what have you. And they learn about, deliberate on, and make recommendations about a complex public policy question. And so this is something that Dr. Chi has talked about, a similar model in Taiwan. And so if the board could, instead of saying we have to make these tough decisions and then everyone just is going to throw tomatoes or, go along with it, what if we saw our role as really clearly laying out what those choice points are, and then requesting resources from the legislature to put together something like a civic assembly where we invite Oregonians who are already, noticing these tough decisions to come and participate in those tough decisions and be resourced to, deliberate on them and make recommendations. It's a really, I think it gets at community ownership, and it also gets at our commitment to public engagement, and it brings in some more perspectives than just the 9 of us as board members or just public comment. And this model is seen as a best practice when it comes to public policy decision making, because it accomplishes things that normal, kind of traditional public engagement models often fail at, like reaching people who wouldn't normally show up to a public meeting. It gives participants enough time and context and information to develop really informed, perspectives on and recommendations. And it produces recommendations that reflect public judgment in a way that the board can't do just listening to public comment. And I think it really strengthens public trust in the process, which is another theme we heard about that you'll see as a through line in the report. So.
Yeah, and just to piggyback on that, my comment was going to be about how important it's going to be when we draft our report to the legislature, that in the public engagement comment, we talk about things like the civic assembly. We talk about doing widespread polling, so we are actually getting input from people throughout Oregon, and the things that we just didn't have the resources or budget to do for our starting point. So it'll be really important we include all of those things in the report. Mary Lou?
Yeah, I agree with all of that. And I'm glad, because I think that was kind of when I entered into the board, that was being a discussion about, could we have these, Dr. Chi was talking about the citizen jury. This sounds like the same kind of concept. And informing people, because it seems to me that when I talk to just folks that really have no idea what I'm up to or what's going on here, about, and somehow it gets raised up, and so they're like, what, and so I think that it really is a lot of people out there that are like, just know that their personal issue that they're dealing with healthcare, and either the payment for it or the delivery of it or the lack of whatever of it, their pet beef about it, or that I have wonderful nursing care somewhere or something like that, really haven't thought about these kinds of questions and these kinds of issues. They just know that either somehow their employer, and they, on their paycheck, they pay something towards insurance, and then when they need it, they go use it, and they are frustrated or they're happy with it. I mean, it's really just kind of more that individualistic thing. And I don't think a lot of people really think about issues of regional or of, the statewide, or who decides on how much their provider gets paid or not. I mean, that's just, I think it's above the purview of most people. And so and as I understand it, about the idea of this citizen jury or whatever we're calling this, that part of it is educating people about what it really is and what, if you pull back the curtain, what's going on behind it, because most of them, it's kind of like the Wizard of Oz, there's something happening back there, but they don't really know what that is and how it affects them or affects their neighbors or, and so I think it's broadening their whatever, and then being able, when they've kind of had that, a bit of that background to kind of go, oh, well, now that would make sense to me, or, oh, well, I don't care about that.
Mhm.
And I also think with the, Helen mentioning like the CCOs that, having started one of them, um, I don't know that we ever really got that much input from the people about kind of the structure of the thing or whatever. They got input about what services they got, what drugs they got, whatever. And and then there's the organizations, like you said, that have more connection with local things, with counties, with CCOs, with whoever that do have maybe more of that kind of view of the world. So anyway, I'm saying that I'm really supportive of the fact that we really do need that broader um, educated input kind of thing. And also, I like the idea of polls too, that really do get at the pulse if you ask the right questions. So, but it's expensive and not easy. Thank you.
I really like the idea of these civic assemblies, and as we've talked about at the board, the next phase of our work at 2729 is a large part of what we're going to be doing in that phase of our work is more public engagement, and that's a fantastic model to do it in, is those civic assemblies. I wonder if I can ask all the board members to help by, let's come up with sort of a list of questions that we would pose to these civic assemblies as we go through our decision making. If we're bumping into issues that seem contentious or seem like we can't quite land on something, let's kind of compose a list. And if you feel like there are some of those, not right now at this meeting, but let's start putting together a list. And then in our report, we can say, here's what we think is the next thing that needs to happen. There are some key issues that need to be worked out with broader engagement with our communities. And here's a couple of, a short list of questions that we would pose to those groups. That would be one way to do it. Getting back to the report, I have a question about the business community. You mentioned that the small businesses were pretty excited about that decoupling of health insurance from employer. I'm wondering if you heard from any large businesses on that issue. I think large businesses in our state are in a really unique situation and with self-insurance and the number of, I think I saw a statistic that about 80% of Oregonians are employed by large employers and not small employers. Even though there are way more small employers, the proportion of our population with a large employer is bigger. Did you get any sense from large employers about that insurance question of like, is that something that they want to hold on to? Is it something that's a benefit to them in terms of recruiting and retention? Or is it something that they would be happy to parlay off and not have to deal with anymore? I don't have any sense of how much providing health insurance as a large employer is a benefit to them or a hardship, and what their response would be to this.
I'm happy to address that. So first of all, one of the things and this is sort of an overall piece in the report that is in the first couple of paragraphs, is that I don't think we can say large businesses think this or that, because we had self-selected folks who participated, and there's always multiple perspectives. So what I would, so that's my first caveat. But what I would say in response, Helen, is that I think folks felt like it depends, right? Like it depends, because some businesses, and this is called out in the report, is that they have very complex systems. They're employing folks across multiple states, and so there was some question about, well, maybe this would simplify things in this state, but I have to still deal with all these other states. And now it feels almost more complicated, right? So there was some of that, but I do think, I mean, we did hear like, sure, that could be that could be really nice not to have to deal with that, but I still might have to deal with it over here. So I think that there were a variety of perspectives on that. And again, I don't think all of the perspectives were, we didn't have all the large businesses in the state, for example. So hard to say.
Yeah, and I would just say, I put it in the chat, but pages 7 and 8 of the report speak to some of those "it depends" contingencies, right? Like if you're multi-state versus just operating in Oregon, it's a different picture. You know, there's a lot of specific things that were raised. Go ahead, Mary Lou. And then I also want to just invite, if there are any board members who are quieter, just really invite your voices into this conversation as well. Go ahead, Mary Lou.
I think it's always interesting. We talk about large and small businesses and, you know, kind of what makes you large, what makes you small, because at the Revenue Committee, we discussed, is it, you know, by the size of your payroll? Is it the number of employees, you know, somebody who has a lot of low income employees versus somebody who has, you know, 10 lawyers that are in a business, and does that with their, you know, overall salaries, et cetera, does that make them large? One of the things that I think is interesting is that the reports that I've read, most of the largest businesses in Oregon are healthcare. So I think that they're hospitals, health systems, and most of them, luckily in Oregon, I think, are local to our state. Although, you know, Providence has Washington, Oregon, California. Legacy really is in Oregon. OHSU, they are really big employers. So I think that not only are they providers, but they're also big employers. And I think they would be very, you know, I think connecting with the Hospital Association to really talk about, and in many smaller communities, they are the largest employer. Then we have a couple of our big, you know, the Nike or the Intel or whatever, that are the really big employers that have multi-state stuff. So anyway, I think that whole issue of employers and what do they think and what would work for them or not, I would really love to see us be able to really hone in and talk with them specifically, since they are really the largest employers collectively in the state, are all the healthcare folks. So anyway, that's just a thought.
Yeah, thanks, Mary Lou. I think that illustrates what Diana was talking about, where these categories sound good and neat on paper, but in reality, what we found is that they're very they're porous, right? Like people fit in multiple categories and speak from multiple perspectives. And I think that definitely came through in the report. I will just say, you know, we did have good representation from hospitals, both urban and rural, across the state. So that was a perspective that you will definitely see reflected in the report. And we were really grateful for that participation from some very busy folks who are dealing with a lot right now. So other questions or comments from the board? Mike, it's great to see you.
Yes, we won't get into my my lack of technology skills here, but as I reflect on this dialogue, and I'm reflecting on, you know, we're supposedly having a report due by September, and we will have a report by September. But I have to make this comment. I think we have to be realistic. If we have half a dozen transition committee meetings and 5 board meetings, we have a lot of unresolved issues. So I'm really looking forward to some additional dialogue with Diana and Mimi about how do we synthesize this? How do we have a high quality understanding of the complexity of all this? And then, you know, candidly, unless we kick the can down the road, how do we make some decisions that are clear and realistic? So I'm welcoming that, but I'm as a co-chair of the transition committee, I certainly feel a certain amount of humility about how the hell are we going to get all this done. So that's my comment.
Thank you for that work, Mike and Judy. Co-chairing the transition committee is a big lift. And I do think that it's a great question, Mike. I do think that I don't think that anyone who is seriously engaged with this work expects us to deliver a final plan that's ready for implementation tomorrow with a bow on top. I do think that there are the questions for consideration in this report that start on page 12 of the report. It's page 13 of the PDF, so it's a little confusing. Are a really great leverage point, both to what you were asking, Mike, around how do we synthesize this? I think that the board could take this list of questions and use it to, evaluate our work and what we can answer and what we need to lay out for future phase of the work that the legislature would, need to choose whether or not to fund and delegate to the board. But I think that these questions also, Helen, to your earlier question around, can the board come up with some of those, tough trade-off issues that a civic assembly could wrestle with? I think that these questions for future consideration are a really rich place to start for that as well, because this is members of diverse Oregon, you know, the public really responding to our draft plan and saying, these look like some tough trade-offs and some tough questions. How are you going to resolve them? So I would just offer, to me, the takeaway of the report, the whole report is really valuable. But when it comes to like, how do we put it into the board's work plan? How do we respond to it? How do we incorporate it in the transition planning committee's work? How do we use it to guide board votes? I think the questions for consideration and the recommendations sections are really helpful leverage points that are actionable for us as board members, as we try to synthesize all the feedback and figure out how to honor it by using it to guide our decision making. So I hope that you all find it helpful as well. And if you have any questions about that, certainly Amy and I welcome those. And if we're still within contract hours with Diana, we can certainly pass them on to Diana if she's available to help answer as well. I'm trying not to volunteer you for anything, Diana. Any other questions or comments from the board?
I had one final one. I know I've asked a lot of questions, but this one's just a clarification one. There's a comment on page 9 that somebody commented that most people agree that the changes from HR1 at the federal level will create more uninsured and sort of create more of a priority or more of a drive to have a universal health plan. But someone made the comment that HR1 might make this proposal more challenging. Can you say more about what that was about?
Yeah, happy to, Helen. I think that we got some input that there's so much going on given the impacts of HR1 that how could you even think about this when we really need to focus on the redetermination issues and all the, just keeping people on care, in care, having coverage right now, and that's a huge focus of states across the country. And so how does this work move forward in the light of just trying to manage those impacts in the immediate term? So I think that was some of the tension that yeah, this makes it even more urgent, but other people saying, how could you even think about this when really what's at stake
We're in crisis mode.
Yeah.
Yeah. Got it. Okay. Not that it would hurt, but it would be just too much to take on in the midst of other healthcare crises.
I think so.
Got it. Okay.
On that, can I ask one thing from the finance kind of point of view? There have been a couple of different ways of looking at the HR1 issue, but mostly what you hear is we're all going to lose a tremendous amount of money from the federal government to help cover and pay for healthcare for our low-income population. While there are some other less vocal folks out there who are saying, well, maybe this is an opportunity to look at doing it differently. Maybe there is ways that we can kind of make it by paying more on certain, maybe the payment that we're paying providers, that we could pull in more federal dollars because it's a match and all those kinds of pieces. And I guess my whole thing about it has been that we had a very difficult job to do. But when this bomb kind of got thrown in the middle for, all the various possibilities, and you listen to different people's perspectives on what we could or couldn't do to deal with it, it just makes it even more complicated. And I think we have to acknowledge that, but it can't stop us either. And anyway, I do hear varying ways, like you said, of thinking about it. And nobody really kind of knows at this point. It's a lot of conjecture. And we do have, I keep telling people, well, the governor has a group that's led by Bruce Goldberg that is really, that's what their focus is. And they're going to be coming out with, what they think needs to be done. And then we'll need to be sure, and I'm glad Bruce will be coming back, because we'll need to be making sure that whatever we're going forward with, kind of melds in with what their recommendations and isn't at odds with it. And right now it's, in my estimation, kind of being kept pretty close to the vest. And whether that's just they haven't figured it out yet, or whether they're just trying to kind of keep it from, everybody conjecturing on it, I don't know. But anyway, it does really throw a bit of a monkey wrench into this whole process that was difficult in the first place.
In some ways, thank you. Yeah, thank you for this discussion. In some ways, it's the context that we're all living and working in. And also, on the other hand, I think that we've been given really clear direction from the legislature on what they want us to work on and see, and that doesn't really change with the external context. I would say a summary of the feedback that I've heard across committees and the board and the town halls last month with HCAO and the focus groups is everyone kind of wishes this work started like 10 years earlier, right? Like, and so it's always the right time, and it's never the right time. And so there's a part of me that's, really kind of like Nemo, just keep swimming. Like the legislature is going to need this analysis, these recommendations, and a really clear-eyed assessment of the work that is still to be done, regardless of what else is happening. And the legislature is really, in my mind, the body that is going to have to respond to and triage the impacts of HR1, political viability, timing, funding, priorities, all of that. Like that's kind of on their plate. And our job is to develop a clear report that says, here's the analysis that's been done, here's the feedback from the public, here are the questions that remain, here's the analysis that needs to be done next, here's the public engagement that must be done before we can finalize details, and then trust the rest of the process. Is really how I'm seeing this. Like, I don't think that I can take on the role of the legislature, and we don't, as a board, have the power to really respond to all of those things. And so I would hate for us to get too distracted, even though I know it's hard. And I don't think that's what you were suggesting,
No.
Mary Lou.
No.
But I think really our work is our work.
Right. My only piece is about the funding. That is, we look at this first thing that everybody says, well, how are we going to afford it? How are we going to pay for it? How's, what's it going to cost? And that uncertain, I mean, we were always uncertain, even from the task force, on exactly how Medicaid, Medicare will fit into this or not. But I think we were feeling a little more secure that we could count that this is what Medicaid has been paying for, this is how much it is, this is whatever. And I think that's the issue that is kind of really troublesome as we're trying to figure out those elements of a tax plan, those elements, because how much money we have to raise to do the kinds of benefits that people want, is where a lot of this tension lies. And I guess that's where I've been, because I was on that committee, and still feel that, the questions aren't totally answered. And that was an often question at the town halls, was about, how is this really going to affect individuals in terms of their taxes? And so anyway, that was, I think, more of my thing. It has to do with how much we're getting now, and that our plan was to be able to hang on to that and maybe increase it. But, when it looks like some undefinable term of amount of money based on how many people keep on, it's not even quite a simple mathematical formula where they said, we're going to cut you by this much. Okay. No, it's this kind of, if people don't sign up for work or they don't fill in or they, and that's all a lot of conjecture. So I'm just saying it makes that financing part even more complicated. That's all.
Yeah, definitely complexity when it comes to the finance and revenue work. Thanks for all your work on that committee. So we do have Diana here, we do have Mimi here. Are there any other questions about the report itself or context for something that you read? Do you all feel like you got everything that you need to move forward with this report? Thank you so much, Diana, for being here. Mike.
Yes, Michelle, in fact, thank you for that question. There is a piece, and I'm going to go back again to when you and Mary Lou and others, including myself, have been meeting with people. There's a subset of people that have approached me after each of 4 different community meetings, and they're small to medium-sized businessmen, and I basically got, I'd summarize 2 messages. One is there's a lot we like about this, but then he said, however, if you could just if you could make this a little bit more affordable or tweak it, and so, I think it's very important in our next stages is not only to complete a report for September, but to continue a process of how do in fact we make this healthcare system simpler, so we don't have to have every Oregonian having a PhD to figure out how the hell to use healthcare, and that we do genuinely understand that if there's any one theme out of at least coming from the businesses, it's making things more affordable for everyone. So I don't. That's my my sense. I was wondering if any of you had any comments about that.
Thanks, Mike. I think that does align with, some of what I see in the report. So when we look at questions for future consideration, on page 13 of the PDF, or page 14 of the PDF, but it's listed as page 13 because there's a cover page. One of the questions for future consideration that arose out of the focus groups is, how will the impact on Oregon's business climate be assessed? So, including potential mitigation of businesses and high wage workers, what options will be considered to mitigate potential competitive disadvantages? So again, I would really direct the board to these, questions for future consideration. I think that you're right. When I read this, it is in alignment, I think, with some of the questions that I got at the town halls, for example, from business folks. And so, certainly we will be adding to this with public comment and other inputs, but I think this is a great piece to kind of keep beside our desks as we're having board meetings and planning future phases of the work, writing the report, having transition committee meetings, because I think it summarizes some of those themes that we've been hearing. And you're right, it's hard to hold on to 200 individual comments, but I think that this is a kind of a good reference point for some of those emerging themes that we've been hearing and that also arose in these focus groups. And that's one that's definitely captured here.
Thank you.
Any other questions for really about the report, about how the focus groups went, what's in the report, what a certain passage might mean? While we have Diana here, I just want to make sure board members get all your questions about the report answered. Go ahead, Mary Lou.
My question, Diana, is you did this work both for the task force and for the governance board. And was there very similar kind of feeling and response or very different? Just kind of in toto, as you reflect back on both of these experiences, what would you say?
That's a great question, Mary Lou. And so the task force, so they were pretty different processes, right? So
Okay.
even though they were small group discussions, the process by which it all occurred, through which it all occurred was really different. And so,
Okay.
for example, you didn't have Michelle and Amy, who I gotta say did amazing work as your co-chairs. I just want to acknowledge that. And they were so deeply involved in this work. And we didn't have that in the task force. So I think that lent like a deepness and a richness to this process that really benefited from that committee's engagement and their contributions. So I want to just say they're really super different. I think the other thing, Michelle, that Michelle already lifted up was we had participation in these focus groups that we did not have in the task force focus group. So I thought that I don't know what that sort of indicates, but it indicates that groups that hadn't come to the table to participate were there.
Okay.
So, and then the third thing I'll say that makes these really different, one is the board is so much further along,
Okay.
and had very specific questions. So I think that really helped, that just made it really different as well. So I hope that they felt really different.
Yep.
I thought we had good participation, but different in both.
Yeah.
But
Okay.
yeah, I hope that's
Just-
helpful.
That is very helpful because I wasn't that involved or paying that much attention when you were doing the one with the task force. And so I just kind of wondered whether, so thank you. That really helps. Thanks.
Helen?
I had one more question about the unions. There was a comment in here that union members were concerned that they might pay more and receive less, that, healthcare benefits are something that unions fight hard for. And I just wondered if you could elaborate on that, the perspective of unions and their role in securing healthcare benefits.
I think the feedback we got differed across unions, right? So different union members, based on their union and their bargaining, get different benefits from different employers. So for some, I mean, we heard, and this was the case not only in that focus group, but across focus groups. And a number of focus groups saying, I feel like there's going to be a bunch of people who pay more and get less. And so that wasn't just specific to that group, but was, a theme that there is going to be a group of folks who will be in that position. So I think that was not just in the labor group, but across a number of groups. And it depends on the union and the benefits that they get.
That's a big deal.
Yeah, I would say for folks who haven't seen the union components in the report, there were a couple of things that really stood out to me. One was that it could reduce complexity of bargaining for unions and allow them to really focus on things they haven't been able to fight for because they had to fight for healthcare because it's such an important economic issue. But on the other hand, there was this concern that, some unions have spent decades fighting for things that they've now won for their workers, and then they'd all kind of get reset to the same level that everyone in the state, has, and some concerns about that. And then of course there are unions that represent high income earners and unions that represent low wage workers, and those are different impacts when it comes to our finance and revenue plan. So yeah, I would encourage folks to just do a word search in the report for union and see kind of the different pieces that emerge, because I think there were multiple points.
And I just feel incumbent to mention that, there across all the focus groups, I think this was there, and I said this at the beginning, there wasn't don't do this. There was, this could be really positive, and the devil is in the details. So I don't want to misrepresent
Right.
that focus group perspective. It wasn't, we didn't hear don't do this. We heard, wow, there's a lot of details here we have to work through.
Got it.
Yeah, that's a great question. Thanks, Helen. All right. Well, I know we're a little bit ahead of our agenda. I do see that 2 of our people who signed up for public comment are here, but we're missing one of them. So I do want to just give one more opportunity. If there's a last burning question, especially anything about the report, its structure, what happened in the focus groups. Amy and I, of course, will be here in future months at board meetings to answer ongoing questions, but this is our opportunity with Diana. So last call for questions about the report for today, and then we'll go to public comment. All right.
Michelle, I would just say, not a question here, but I would just say, is there anything that we've talked about today at this meeting or that you saw in the report that we need to include as a future agenda item at a board meeting? If you have something you want to shout out now, that's great. If not, you can send an email to me or to Judy, that if something, we always sort of, when we have these discussions, if there's something you need to know more about, let us know about that for agenda planning.
Yeah, thank you, Helen. I mean, I would say one thing that I heard really clearly that I appreciate is that the board really needs some support, I think, from Amy and I in CECC in taking the public comment that people are spending time and energy submitting to us, showing up at meetings and providing, that we need to put that into a format that is easier for the board to keep in front of us in terms of like, what are the themes? What are the repeated points? What are the repeated questions? Because we're getting to, we're in transition planning, we're writing a report, and that volume of input is really valuable, but a little hard for individual board members to wrestle with. So I'm wondering, certainly we have some ideas. We've already talked with you, Helen, about some of them, but I'm just really taking away that role in the coming months that Amy and I and CECC have to bring some new resources to the board. And I really appreciate the space that we had in this meeting. This is one of the few opportunities we've had as a board to really discuss public engagement and public input. And so I guess we can certainly bring those resources. They'll mostly be written, and we'll make them as kind of easy to scan and digest as possible. But I guess if there's anything else that you, Helen, or the board feels like would be really helpful specifically in keeping public input, whether it's this report or other forms of public input, in front of us in an actionable format, that's what we're going to be working on and working to bring to the board at future meetings. And I don't know if that needs to be an agenda item, but that's certainly a task that I'm taking away.
Mm-hmm. Yeah, I think what you said before about having, talking about the structure of that at our next meeting is going to be key. And then and we can just keep it on the agenda as a standing item and think through how that might evolve.
Yeah, great. Mike, I see your hand.
Yeah, based on, again, other experiences I've had years ago with on the Oregon Health Council and the like, there are times when you really want a lot of input and there's a lot of divergence. But I just want to speak to not just my fellow board members, but the community. We're at a junction now where we've got to begin to move from divergence to convergence. And convergence means if we can come up with the wisest elements in the plan that are specific, I think that's what I hear Diana saying, is that people want more specifics. They don't want us to essentially just come up with a theoretical plan that kicks the can down the road. If Diana or our two co-chairs have any other comments on how do we best efficiently in the next 3 months get to convergence, I would certainly appreciate any comments you have on that.
Thanks, Mike. I think it's a great point. And I would say, yes, there was definitely a theme of wanting more specifics. And there was a theme of wanting to be involved in like determining that. So I wouldn't say that the report says go away and come up with the wisest plan.
Right.
I think the report says we are part of how you come up with the wisest plan. And we want more specifics, moving forward. So again, I really see our role when I read the ORSs, the bill that formed the board, even the governor's signing letter when she signed the bill that created this board, I think that there's not really a lot of legislators or the governor or members of the public who are following this work who expect us to have full convergence when we write the report, certainly in September. So again, I think just being very, very clear about what analysis has been done, what analysis still needs to happen. And I think this report is helpful in pointing to some of those priorities. And then, what some of the tough trade-offs that we have done enough analysis to surface, which is really valuable work that hadn't been done yet, right? That's a big contribution. And some of our process recommendations for wrestling with those and an estimate of what resources it might take to accomplish it. I think that really empowers the legislature to decide, where we go next and how to resource this work adequately. So again, thank you for being the co-chair of the transition committee is a huge lift. I don't think anyone's expecting you to resolve all of this. I think that they're expecting clarity on what work has been done, the foundation that's been laid, what work is yet to be done, and some recommendations on how we get there is really, I think, when I read the report and how the public will be involved, right? So happy to continue to support the transition committee in that question around how we involve the public. Great. Amy, do you have anything else before we transition to public comment?
Nope, I was just gonna say, should probably transition to public comment. We have 9 minutes left.
Perfect. Well, thank you all for this rich discussion. I really value this time. I know it's hard to carve out and you're all so busy, but really appreciate this time to really have a focused conversation about public input, which I know is something the board has been committed to since day one. And it's work that started before our board was even formed, but I just really appreciate the thoughtful questions and comments. Thank you, Diana and staff team, for everything that went into this report and putting this in front of us so we can have this informed conversation. So with that, we do have some members of the public who signed up and who also have generously shared their time with us this morning. So I think Mike Huntington is up first, and then and there'll be I don't see Olivia here, so I'll keep an eye out for Olivia. But Peter Addy, you will be next after Mike Huntington. Mike, are you able to turn on your microphone?
Yes. Can you hear
Wonderful.
me?
Yes, please.
Good. 2 questions relating to convergence. With the provider surveys, did the question of a formulary come up that would be 1 instead of 15? And if that's a good idea, how can we get physicians to think it's a good idea and could benefit them? And that would apply also to medical devices. And then the second question is on union benefits. Can we comfort unions by saying there will be wraparound benefits to those that they don't have guaranteed under their union contracts?
So those are great questions, Mike. I did write them down, and we will certainly take them into consideration. I don't know that we were necessarily prepared to do live Q&A here in a public meeting, but I will do my best to follow up with you, and I have definitely recorded your questions. So thank you so much for being here. Did you have any other comments for the board?
No, just thank you for all this work. I just can't imagine how much time and effort you put into it, and we really appreciate it.
Thank you, Mike. And thanks so much for following our work and providing input to us. Appreciate it, as always.
You're welcome.
Peter Addy, are you here and able to turn on your camera and microphone?
1 second. I'm just a little
Oh.
slow on the clicking.
Oh, sorry, Isabel.
Peter, you should, now Peter should be able to share.
Hi, everyone. Good to see some of you again. If you don't know, I was on the Plan Design and Expenditure Committee, which just stopped meeting last month. And so now I'm here just talking as a regular member of the public. I'm a psychotherapist and clinical supervisor and educator in Portland. So I've been thinking a lot about the principles that the board came up with 2 years ago. Principle 5 calls for community sense of ownership and governance. Right now, the governance is just set up to be gubernatorial appointments and Senate confirmation for a board, and that does not produce community ownership. These kinds of advisory only regional councils and focus groups do not redistribute power. They deliver consultation, not governance. I really liked how Michelle Glass was talking earlier about civic assemblies, and I want to affirm that instinct and ask the board to follow it all the way through. So some examples of that: civic assemblies that have binding authority, not just advisory status. I think that that's been tried in multiple countries, Ireland, Canada, Belgium. So you select citizens on these kinds of matters, and then they produce decisions that the governments are required to act on, right? I think that it's we should mandate explicit seats on the governance board for organized labor, not just like administrators and executives. And other countries like, so Taiwan, Chun Wei-chi, of course, knows more about that than I ever will, but ask this V Taiwan initiative is really interesting. And Brazil has been doing these health councils since, I think, the early 90s, where they have these like neighborhood and municipal national health councils that actually work to govern public health. So that's what we need, not just public engagement, but informed public governance. So thank you.
Thanks so much, Peter. Thanks for being here even after your volunteer board service gave you some time back. Really appreciate your ongoing participation with us and your comments today. Thanks so much. And it sounds like we have Lou.
Yep. Just 1 second while I do the clicking, and Lou, there we go. You should be able to unmute now.
Thank you. Go ahead, Lou.
Hey, hi. I thought you were going to forget me.
Yeah, my apologies, Lou. I didn't see you on the list ahead of time.
I didn't see you there. Well, first of all, I'm really happy to see you all again. It's been a while, and it's very good with the report. There's so much I could say. It looks like I'm going to have to write you all. So, first of all, the main thing is going to be the taxes or premiums, right? We know that. So we need to figure out what the savings of the plan will be. Secondly, I wanted to say that while you all have made great progress, the law expected a plan. So now what we switched from is a plan, a universal health plan, to a report or recommendations. So we'll have to deal with that in the future, right? I wanted to take a little time to talk about what I was struck by from the report and also many of our discussions here. And that is, we all seem to be stuck in thinking about healthcare through the insurance company's lens. And it's very difficult to pull our minds out of that. So when you're talking about regions, local regions, and all that, as Helen pointed out, that adds administration costs. But there has to be feedback, but I don't know that it has to be regions. For instance, I don't know if you're all familiar with, I'm sure you are, Puce Health wanted to contract longstanding Eugene emergency physicians to Apollo, which was in Atlanta, Georgia, and it's a management services organization. Ultimately, they won, but the thing that people think about is those catastrophes and those decisions that are made for profit rather than service. And what we're working on is a service, not a profit. What we're going to have is a system that maintains itself, but is not going to do for profit. So that's what changes. That's what's hard for people to get their minds across. So thank you for letting me go over time a little bit. But I'm all for you. We'll get there. Just let me know if I can help. Thank you.
Thank you so much, Lou. Yeah, thanks for that reflection. Appreciate it and appreciate your ongoing participation with the board. Is there anyone else, Isabel, for public comment?
Too many things. Nope, that's everyone today.
Thanks so much for all of your expert work in the background. Sorry. Okay, perfect. Well, thank you to everyone who provided public comment. Thank you, board members, for joining us for this conversation and digging into the report. And this conversation is a great starting point. It will, of course, continue. So, let us know if you have follow-up questions or comments or thoughts as we move forward. And I hope you all have a great Tuesday. Thanks so much. Take care.
Thanks all.
Thank you.